Death rates are also done per 100,000. So you can see over here the death rate, if there were 100,000 people, goes down here for the total, but with First Nations people at the very end, we have a death rate of 633.9 per 100,000, and 1,140, so it's going far up. Again, at this time, the Manitoba First Nations population, they said was around 2.5% of the total Manitoba population. So these numbers are obviously like way overrepresented. For only a small fraction of that population, their numbers are really big. So they have all sorts of charts like this in their annual reports to kind of show what's going on in terms of treatment. Usually they want to show improvement over time. Sometimes they want to show, oh, there's still a crisis, we still need to have funding, we need to keep our hospitals open and that kind of thing. So these surveys, the Manitoba Sanatorium Board basically does its first survey in 1937 of First Nations people. They go to 6 different reserves and 7 different residential schools. And basically a survey is an X-ray survey. So they're taking mobile X-ray equipment with them to First Nations communities, and they are doing an X-ray. They also did skin tests, so there's a tuberculosis skin test as well. And the earliest surveys also had tests for syphilis. So they would kind of do different kinds of health testing along with these surveys as well as they were touring around. Yes, this was part of the problem because when a survey came into the community, they wouldn't kind of leave until they felt that they'd had done the entire population. However, people would go away while the survey was going on to avoid being X-rayed and to avoid kind of being included in it. So they were never complete surveys. Also, especially before 1945, even though these surveys happened, there was no real plan of what to do with people who were found with active cases. And so in Manitoba and elsewhere in Canada, First Nations people were not welcome in public hospitals. In order to obtain health care, a status Indian needed to get the permission of an Indian agent because the federal government would be covering the costs of the health care. So the Indian agent had to approve them going to a hospital. The hospital also had to approve them going to the hospital. And so hospitalized, like in an era when there was very little space for First Nations people in hospitals, often people just, they were tested and then they were left alone. And this was a real crisis in residential schools, as you can kind of guess. With an infectious disease, obviously you've got people coming in a tight space together, they're living together, and then they're going back to their communities and kind of taking the disease back. So in more than one community in Manitoba, the surveys were not welcome. And so people refused to be surveyed. They would kick people off the reserve. They would have a lot of difficulty, especially in the 40s, in getting communities to agree to be surveyed. And this was basically because there was no real healthcare response anyway. Yeah.
See, I live in that area, so I know as something. But I know that our people, especially the Métis people, were not looked after by the government.
Mm-hmm.
So they tried to avoid anybody that had. Some of my families died but earlier in the very early 1900s, 1900, 1901, all through there, they just died like flies. Mm. But they didn't want to get that test because they used the same needle on everybody. So if you didn't have it, by the time you had the test, you had it.
Yeah.
So it was, and the Red Cross was in there helping very, very much.
Is that right?
Because I remember my dad telling, if it hadn't been for the Red Cross, so many of our people almost a way of getting rid of the Indians again. It's the Métis, because what were they gonna do with them? They didn't wanna be white, they couldn't be Indian, 'cause neither side wanted us.
Yeah.
So here we were,
Exactly.
in a bind.
It was a real healthcare crisis for sure. Yeah. Yeah, so with this resistance to having, those kinds of surveys, the one way to have communities agree to be surveyed was through coercion. And that's basically what happened with the surveys in the 40s. They started to connect in with treaty parties. So and a treaty party basically is a group of people, the federal government, usually a justice of the peace, or a judge, and the Indian agent, a representative of Department of Indian Affairs, and they would go around to the treaty areas and distribute annuities, which were guaranteed as part of the treaties. So a yearly annual payment, basically. So the X-ray parties would go along with the treaty parties, and they would X-ray people before they could receive their annual annuity payments. So that was one way of ensuring that you got the most amount of people to kind of show up for the surveys and get tested.
Schools as well.
And the schools, yeah, exactly.
And grab all those kids and inoculate them for TB.
Huh.
People, parents were up in the air, what's this, why? But it was done without the knowledge, really. They came in, there was a CNR train in our neck of the woods, and they'd come in on the train, and nobody would know they were there until they were in the schools doing what they had to do. But all the government sent them, it wasn't anything, that they were doing subversively. It was they were doing their jobs, but they weren't asking the parents what kind of, are you all right? Are the children fine? But no, just do it.
Mm-hmm. Yeah, not a lot of consultation in this time period, for sure. Yeah. So we have a picture of a woman here who's being X-rayed. Basically, this is the X-ray equipment that they could carry around on the treaty parties. And you could tell she's probably in a fur trade post there, I think, because you can see furs and you can see guns, and often the treaty annuities were paid out in a kind of community building, so in a community center, whatever was available in the community. So that's where that's likely taken. Here's another picture of a treaty party going into York Landing. So that's Nelson River Agency, so up north in northern Manitoba. And this is a post-war photo because there's a plane. This is obviously the main way of kind of distributing health services in a post-war era, especially in Manitoba when there's not that many roads going north. So they're kind of unloading the plane. And here's one more picture. So this boy's they took X-rays of the front and the back. And these are annual, so they did X-rays every year. But it's interesting also to see how X-ray technology has changed over time as well, and the way that the equipment is used. So once kind of after, especially after 1945, the Indian Affairs stops dealing in the business of Indian health. And Indian Health Services moves to a different federal department called the Department of National Health and Welfare. And that's basically where it still is today. So that shift was really significant because we see after the Second World War a lot more money being spent on Indian Health Services. And so once these surveys keep going and going, the Canadian Tuberculosis Association puts pressure onto the federal government to ask for more of a response. What do we do with the people who are surveyed? We find with active cases with tuberculosis. And so officially, the line was of the Tuberculosis Association was that elderly people, what they called hopeless cases, so people with far advanced cases of the disease, were to be left at home. And they were to be cared for by local nurses if there were any, and anybody kind of in the area. But the younger, what they called more hopeful cases, intelligent Indians, they said, who could kind of benefit from a period of being away from the reserve, would be removed and treated for tuberculosis in special sanatoria. So we see, like right here, there's more to medical treatment than simply kind of surgery and a program of antibiotics. There's a specific targeting of an age range for kind of a program of social treatment as well. So they're interested in having young, kind of intelligent Indians they could take to Sanatoria. Yeah.
Isn't it kind of ironic because probably a lot of those young, intelligent Indians were in residential schools, so they brought it out to the community so that the elderly were getting it?
Right. Yeah. So in Canada, obviously this is not just a First Nations problem, the tuberculosis, all Canadian populations were affected by tuberculosis. But there were provincial public health laws that enabled organizations to suggest the removal and containment of people in sanatoriums. For First Nations people, it was written right into the Indian Act. And so when I say the Indian Act, do you know what we're referring to? Yeah, more or less. This is going to touch in on Araha's kind of territory when she's talking about policy. So the Indian Act is basically the federal law that deals with First Nations First Nations people in Canada. So to be a recognized, legally recognized status Indian in Canada, you have to comply with the Indian Act. So it's a series of different laws that relate to First Nations people, and it's really long and awkward, but I just have this section that deals with the powers of the federal government to remove people from First Nations communities. And this is the 1927 Act. Obviously the Act gets revised over and over again. There's another revision in 1951, but with respect to removals, it stayed very much the same. So it says, this is the classic Indian Act line, but the Superintendent General may. And Superintendent General's representative on reserves is the Indian agent, basically. So the Indian agent on reserves has the ability to, and this is just a list of different conditions by which he can kind of exert his powers in the area of public health. If the houses are unclean, if there's overcrowding, too many people living in the house, if he suspects that there's somebody who has the disease or is coming into the community with the disease, might leave the community with the disease, he can kind of regulate the movements of those people on and off reserves. It does have a line that if he suspects that there's somebody who has the disease, he can provide medical treatment, but of course, that one wasn't practiced as much as the practice of, say, ordering people where they can live and where they can't live, and ordering the removal of people. So for again, in the Indian Act, usually when there's a law like this, there's a line that, okay, any decision that's made by the band that contradicts what the Superintendent General says, the Indian agent says, the Indian agent trumps that decision. So that's number 2. Number 3 is basically that to back that law, there's fines. So they're subject to a fine of not exceeding $30 or imprisonment for 30 days. So that's a kind of backing behind this program. So the medical theory behind sanatoria, and that's that because the disease is contagious, you want to go out and survey people that have active cases, remove them to a contained area where they can be isolated, treated, and kind of prevent the spread of tuberculosis elsewhere.